right. Hello, everyone. Welcome to another episode of Flip the Script. And I am Dr. J. Joe here with my good man, Cameron. And we're going to hopefully entertain you on a little bit of, something we hope is common sense, or it will be when we're done. Right, brother? Mm-hmm. I think we've got some Q&A that we want to go over today, right?
We got three questions.
All right. So this will be fun. Put me on the spot, and yourself as well. What do we got?
We got Kimberly from Smyrna, Georgia. Shout out Julia Roberts' hometown.
Smyrna.
Pretty woman.
I know Smyrna's out. I know where that is. That's somewhere outside Marietta. All right.
Marietta. Let's see. She says, I've been diagnosed anemic. My most recent blood work showed red blood cell count low at 3.77, hemoglobin 10.2, and what is that word I was trying to pronounce?
Hematocrit.
At 32, and then iron level was at 34. Now I don't know anything about these numbers, but if somebody's dealing with it with their doctor, I guess they would know.
Well, they're on the tad on the low side.
Okay. It says, my doctor put me on an iron prescription. However, it's upsetting my stomach to take it. What's your advice for her?
Prescription iron can be tough. Yeah. Well, you know what, though? Kimberly, anemia, it seems to be on the rise. I've had 3 or 4 cases in the last couple of weeks, and probably half a dozen in the last 2 months. I don't know if we had a little thing going on here, but it doesn't surprise me, Cameron, because, when you look at number one, our American diet, nutrition depleted foods, it's not uncommon for me to see these conditions now. And of course, with that, not only that, but we also have all this antacid use over the years, not to mention 20 years now of what we call the protein pump inhibitor, which we talked about on the podcast a time or two, how this just stops the biochemistry of the stomach, which is to make acid. So, Kimberly, with this all together, this is contributing to what we're starting to see now in modern society, and that is lack of the ability to absorb the iron. So again, think about this. If the stomach, with its chronic antacid use, and like I said, we're looking at 20 years now of the protein pump inhibitors, I think this could be why I see such a rise here, because it all kind of comes down to the same underlying factor for the most part, and that is that a lot of people, even if they're consuming food with the iron, which would be things like the red meat or spinach is another great source, but a lot of them not getting in the diet. But it's these low HCl levels in the stomach, when without the hydrochloric acid in there, they can't break down minerals, and they certainly aren't going to break down iron. So for me, with my patients, that's the first place I'm going to look to. Okay, I'm trying to increase those levels. And then try to find a gentler form. I've also found that helps a ton with some of my patients when I put them on a product called Ferrofood, which is a lot gentler iron salt, and they seem to be able to break that down. But if you don't have that HCl in the stomach, and then remember we were also talking about that intrinsic factor that is so important for breaking down iron and mineral.
We've talked about it, but they may not know what is exactly.
So that, the intrinsic factor is found in basically 2 species, us and pigs, right? So, and of course, it could be because our diets are somewhat the same. I don't know. But again, this is an enzyme that helps with the breakdown utilization. A lot of people with pernicious anemia, for example, they might be taking their B12 and they might be taking their iron, but they really can't absorb it. And for a lot of them, like Kimberly was talking about, they get nauseous, all right? And sometimes they even wind up throwing up from the discomfort of it, right? So a product that I like to use in my clinic, and we'll talk about this for Kimberly, is a product with hydrochloric acid and the intrinsic factor in it as well, so that we can absorb. Because again, remember, it's not about the digestion like we were talking about a week or so ago when we were talking about the Easy Mag. It's not the digestion, it's the assimilation that we're having such a problem with. And because of these American diets and these high carb and processed foods, and remember, they don't have the enzymes in them. And so if we're not consuming some kind of enzyme with this, which is what basically the product that I use is a digestive enzymes with the hydrochloric acid, we are being able to take care of both of those deficiencies at one time. So Kimberly, understand that's what we want to look into, a product that increases HCl supplementation. And then we've also got to restore those digestive enzymes back. Because when we're processing these foods that are inadequate in nutrition, they're also inadequate. And that's what I think I'm seeing, because I'm seeing a lot of this now in my patients over 60, right? Because they've been on these antacids for 20 or 30 years and across the board. So what I like to start with that is I use a product, anything with hydrochloric acid. All right, there's a lot of different supplements up there. I use one called Zypan, Z-Y-P-A-N. And again, this is not surprising to anybody, I hope, but it's standard processes product because that one has the intrinsic factor that we were talking about in there, right? And you also have the digestive enzymes, most importantly, pepsin, for breaking down the protein. Because again, if we're breaking down the proteins, especially the things like the red meats, we're going to increase that iron naturally, which is what I want you to try to think about when we're consuming that, is try to find a natural source in your diet. But if you can't, you're going to have to supplement. So that's where I like Zypan to increase the acidic level so that you won't have that discomfort when you're trying to bring the levels up. And then another product that I use for that is a product called Fair Food. Again, F-E-R-R-O-F-O-O-D, Fair Food, right? And again, this is a gentle form of iron, ferrous lactate is what it's called. So it's an iron salt that's very, very gentle. And my patients have experienced very no discomfort actually using it. And I'm able to bring up those iron levels fairly quickly. But personally, what I like about Fair Food, it contains the B12 in it as well. So it's a great product. It's ash minerals. You got B12. It's from alfalfa plant. Liver and bone marrow, which both are blood builders, right? And if we all ate liver again, here we go, right? Liver is a great source of that, but we just aren't eating it. But there's not enough liver in the diet today, right?
Yeah.
And but all of these are found in Fair Food. So again, we got another organic, whole food based product that helps me get the job done. So that's a good place to start there with the building the iron.
Okay. Do you want to do question number 2 now?
No, I got another one though. I want to talk one more thing on this.
Okay.
Okay, I want to talk about that chlorophyll because I'm a fan of chlorophyll, and we talked about the chlorophyll complex. So when we're looking at anemia too, we're also looking at problems with low platelet count, and this is the one product that I found when people have difficulty bringing up the platelets along with the blood themselves is the chlorophyll. Now, the chlorophyll, again, if you think about it, it's just, it's a general mineral source of iron, a natural general mineral source. So it's great for all blood building as well. So when we're talking about the hematocrit, the hemoglobin, and all this is overall great product for bringing up 3 of those. And also the beautiful thing is a lot of times associated with these kind of problems, Kimberly, because with this anemia, sometimes we'll find acid reflux and things associated with these gastrointestinal problems. And with that, ulcers. And nothing puts a fire out of an ulcer faster than chlorophyll does. And one other little pearl real quick for people. I had a patient of mine, for example, had a chronic problem with anemia, 76-year-old male. He needs shoulder surgery, but they won't perform the surgery until he can get his iron levels up. So looking over his blood work, we found a little pearl here, and that was that his eosinophils were also elevated. And anemia sometimes in chronic cases can be linked to parasites. And when your eosinophils are elevated, one cause of that, parasites. So I put them on a parasite protocol as well. Sometimes you have to look outside the box when it comes to anemia. But this thing seems to be on the rise. And if you want to point it to one thing, not enough adequate acid within the stomach. Hope that's kind of sheds a light on that a little bit for you, Kimberly. But let's move on to number 2. What you got?
Okay, so question number 2 is from Mike out of Miami, Florida.
Mike from Miami.
He says that his father is 75 years old. Miami, you.
That's my old hometown just south of there. Yeah. All right, what you got? What you got? Mike, what you got?
He says that his 75-year-old father is having difficult time maintaining his weight and complains that he's losing his strength, and he wants to know what your thoughts are about that. What could be done?
So dad's 75. Condition sounds like sarcopenia, which is where, it's a condition where it's classic characterized by the weight loss, sometimes loss of the strength in the muscles as well. This seems to be, it's one of those cases where in the elderly you'll get somewhere anywhere from what did it say, 20 to 50% loss of muscle mass with sarcopenia over time. And the key to this is that, a lot of times with the elderly, what you'll find with this, Mike, is that dad may be trying to consume a food to maintain the weight, but if he's not adequate in his branched chain amino acids. So what happens a lot of times with the elderly is they're eating the protein, for example, but they're not assimilating the protein. If they don't assimilate the protein, of course, they're going to lose the strength and the muscle mass. We know how important that is, right? At the gym, for example. Mm-hmm. And that's why we use them sometimes, and it's very common when people who exercise, athletes. But the elderly, we don't think about that so much, right? So even though he may be consuming that protein, we've got to make sure that he's assimilating that, all right? And turn to, again, find you a good source of a branched chain amino acid. And another real component in here that you don't hear a lot about, and that's ribonucleic acid, RNA. That's important for that replication of the DNA, which is also needed for cellular turnover. So if I want to increase the longevity of that cell, which helps to primarily decrease that aging process, which for me, my opinion, when it comes to anti-aging, this is one of the top 3 or 4 protocols to help not only cognitively, which RNA is great for, circulation of blood especially, which helps with the blood, of course, to the head, right? Brain. So cognitive sharpness, that's a great way to go. Think that. And also they're both considered what we call emastication factor, which is, that wasting away. So it's part of the aging process, but we can slow that down. Thank your branched chain amino acids there. And also another one, exercise-wise, right? When we get into the elderly, personally, I like that resistant exercise. Weightlifting is one of my favorite. Isometric exercise, we talked about that too the other day, right? With especially the slow descent.
Less risk of injury for sure.
Yes.
Slow and controlled, very smart.
Form, very important, very important,
very
right?
important.
But we need some kind of resistance on those muscles to keep them, because once we lose those, that's the key thing too. People, especially in the area of the legs and the butt, once you lose that, it's real hard to get it back, especially over the age of 60. So Mike, tell dad to hold on to it the best he can. Find some kind of exercise with resistance that he can do comfortably that he enjoys. That's a great place to start. And another one is a great book came out 10 years ago. Check this out if you can find this. You can find it on Amazon. It's called Slow Burn. Okay, this book was designed basically for, the over 50 individuals who, basically, and a lot of these workouts are just like one workout per week per body part. So that's a great place to start too, Mike. Hope that's helpful for you. But branched chain amino acids, not just not taking the food in, he's got to assimilate it again. Remember that. So give that a shot. Let me know how that works for you. Be glad to hear back from you. Have we got another one there, Cam?
We do. We have one more. Actually, a local here from Birmingham, Alabama, not England. Melanie. All right, so this one's a little longer. I've been struggling for years with heartburn and acid reflux, difficulty swallowing my food on occasion due to pressure in my sternum area. On several occasions, I've awakened in the middle of the night with chest pains radiating into her shoulders, fearful of a heart issue. I've been to the emergency room only to have them rule out a heart problem and have been sent home with a diagnosis of acid reflux and heartburn. After visiting a enterologist, I was diagnosed with a mild hiatal hernia, non-operative at this point. Any recommendations?
Not operative at this point. Good.
Yeah, it sounds
Lucky
like
for you,
there's-
Melanie,
yeah.
because those. I have not yet to see one of those that, in my, So avoid that if we can. But however, she's still suffering, right? First thing she did, best thing, rule out cardio, some kind of heart related issue, because that's sort of classic of the heartburn associated with the hiatal hernia. And again, the clue was it was right there at the sternum area. And I've got patients. I've got one patient in particular when hers flares up, and she's a small woman. She can't take down water, and until I treat her for that hiatal hernia and the technique that I use that's very gentle for reversing that, she can go days without even getting anything down. And hers was small too, so hers was not operative as well. So Melanie sort of and they both happen to be in Birmingham. How about that? But getting back to this is real. I've been pushing in these hiatal hernias since 1970 1990 when I got out of school. I had a patient at that time used to fly to me from Chicago just to have me push.
You told me that
hiatal hernia.
years ago. You
Yeah.
told me that when I was met you when I was 18, 19, maybe 17. I don't remember.
A few years back, right?
Yeah, you told me that back then because I remember I was looking into going into chiropractic back then. So you'd bring me back in your office and we'd talk and stuff. And you actually told me that story years ago about the person from Chicago that was flying out to get
She
that
would
done.
fly in. I have them now come from other states to me to have this done. Up northern part, up in Huntsville, drive down. Because, again, I wish more people were doing this. It's a gentle procedure. But the key thing here with that is that, back then I was pushing in one maybe every few months or so. Now it's not uncommon in my clinic. I might see, in 2 or 3 hours, I may push in 5 in the morning sometimes. They come in spurts sometimes, but they're so much more commonplace now. And when we look at the cause of that with this, Melanie, you've got to get to the underlying cause. All right, this is reversible, right? And often, sometimes there's been occasions where I only had to push it in on somebody one time with this one woman, she was so severe she couldn't even lay on her stomach on a table. It was another doctor's patient of mine, so he called me into the room. I pushed it in for her. I saw her a few months later somewhere, and I said, I recognize you. And she says, yes, you pushed in my hiatal hernia a few months ago. And I said, well, how's that going? She said, never had another problem with it afterwards. That is a rare occasion. That's good, right? But for most of my patients, I find I have to perform this procedure a few times to get it to stay. But the key thing is we have to fix the why it's happening, right? And again, we go right back to that same thing we were talking about earlier, HCl, lack of hydrochloric acid within the stomach. And what happens here with this is that when you're ingesting these food, Melanie, for example, especially the carbohydrate, the stomach is taking this food in, and then it's creating a gas with that carbohydrate, and that gas is pushing up on the stomach into the diaphragm, and that area where she's having that discomfort and where I perform this procedure is right there where that stomach pushes through like you blow a balloon up through the diaphragm, right? So, and they can be tiny, as small as my pinky sometimes. Sometimes they're some of them can be rather large. But the thing to restoring that is you've got to, again, quit using the protein pump inhibitors and the antacids, because even though they're reducing the symptoms, they are chronically making this condition worse over time. All right, so again, 20 years on these protein pump inhibitors, we're starting to pay the toll now. But the inadequate diet. So let's go back to that carbohydrate. You're consuming that carb with a protein. The stomach is not going to let go of that protein until it's digested. So if I don't have that hydrochloric acid or that digestive enzyme we were talking about earlier, that pepsin, all right, that protein's not getting broke down. So that carbohydrate's breaking down very quickly and creating a gas, and that's where that pressure is coming from. So how do I go about correcting that? Well, I go after the cause, which if I'm using a protein pump inhibitor or an antacid, it's the wrong biochemistry. Makes sense? Because I really need more acid. So it's an oxymoron to treat it the other way. That's why I see these conditions becoming more and more chronic. So think of a product like Zypan that we talked about earlier. That's one straight up HCl and digestive enzyme. Another product that I like is from MediHerb called Digest Forte. This is the bitter that we were talking about for the GLP-1s for helping with weight loss, but it also helps with the body's natural production of HCl. So the results are going to be somewhat the same. A little quicker with Zypan, in my professional opinion, over the years. But that's where you want to look to. You've got to reverse that problem, and then as we slowly get this reversal of the hiatal hernia before somebody surgically gets a hold of that thing, we can reverse the issue. Now, sometimes coming off a protein pump inhibitor like Nexium and Prevacid, slow go. Because if you try that cold turkey and you get acid rebound, you're not going to like it. So a lot of times I have a protocol just to get you off of that. Wean you off, I guess is the term I'm looking for. But it's totally doable. So again, this is reversible, Melanie. This is another one of those conditions where it's metabolic in nature, means metabolize our way into it with metabolism. So let's just correct that problem and work our way out. So if you can find you a doctor that's experienced in reversing these hiatal hernias, it's a manual procedure, gentle manual procedure. And I talk about this in my book, Light Your Fire, my first book, on page 53 through page 56 in a little bit more detail and a little slower than I tend to be sometimes on these podcasts. So, or you can visit me on my website, www.drjoeyjones.com, and you can go into some of my articles in there and you'll read about this in detail as well. And hey, get a hold of me and we'll get you started on the road to recovery, because it is reversible. So good luck with that, Melanie. And I hope we covered those in detail. And if not, please give us a shout back. How we doing there? Good. Anything else you want to cover on this one?
No, we got all of the 3 questions that we chose.
Do we
got
want
those
to
knocked out?
Shoot on to number 2, or what do you want to do? Got anything else for this one?
Yeah, that's it. That's all I got down.
All right, well, let's just let this one ride with that, because that was some good info, right? And let's just, short and sweet, so to say, on this one. We love the questions, so please don't hesitate. I hope you learned something here today. And, hey, if you want to opine, please feel free to do so. If you got a question out there you'd like for us to take a shot at, do not hesitate. And remember to always stay consciously aware of your awareness of consciousness. I almost slipped up on that one. And, AKA, have yourself a great day.
So you ain't missing one.
There you go. Till next time.